My first question is, what is the best method for selection of sperm in IVF?
Yes, so once ejaculated sperm is given, which is raw sperm, so then you need to prepare. There will be a lot of abnormal sperm, a lot of immotile sperm. You need to deselect those sperm, and you need to select healthy motile sperm for IVF or ICSI. So which is called sperm preparation. So traditionally, two methods used for sperm preparation, which is the swim up method, where the sperm has to swim up. The healthy sperm should swim up in the culture medium, or you use we used to use centrifuging the sperm, which means spinning of the sperm. So more recently, we start using microfluidics chips, which mimics natural conditions. So naturally, what happens in natural conception is after intercourse, sperm gets deposited, of course, in the vagina. Then sperm has to swim up through the cervical canal. It has to go through the epithelium of the cervix, then has to swim up through the endometrium, which is a uterine cavity, and has to swim through the endosalpinx, which is the epithelium of the or lining of the fallopian tubes, to reach the end of the fallopian tube where the sperm meets with the fertilized egg. So during this process, unhealthy sperm gets deselected because they run out of energy. They cannot make it to the fallopian tube. They get deselected. Also, some motile sperm with a DNA damage also get deselected. Naturally, healthy group of sperm will reach fallopian tubes, then meet with eggs. So this new method for sperm selection called microfluidics, using a device, for example, called Zymote. So you deselect sperm in more physiological way. So because in the microfluidics chip, you have got channels and where the sperm has to swim through. So a lot of sperm with abnormalities can't fit through these channels. So they stop, and also sperm with poor motility or with DNA damage get deselected, because sperm with DNA damage doesn't have sufficient amount of energy or motility to go through these channels to get selected. So this is why this method, which we use for all our patients, is the best method for sperm preparation, which means you don't need to worry about sperm DNA fragmentation test, because it is irrelevant here. Because even, let us say, for example, the patient has got 20% or 25% sperm with a DNA damage. So which means 80-75% of the sperm doesn't have a DNA damage. That's actually a positive result for sperm DNA fragmentation. That's abnormal. Even if that patient has a IVF or ICSI using sperm preparation using microfluidics channels, all this 20-25% of sperm with DNA damage get deselected. They don't make it to the preparation stage. So then you use a sperm without the DNA damage. So this is why this new method, appears to be most effective method for sperm selection. So for example, after introduction of this in our clinic, we immediately saw better fertilization, better embryo development, better pregnancy rates, better live birth rates. So which means a lot of sperm otherwise get selected for IVF or ICSI with a DNA damage or abnormalities get deselected in this method. So that seems to be most superior. And also when you use a centrifuge, that's a stress to the sperm. Even healthy sperm may have a DNA damage because of preparation, because of centrifuge in the lab. So yeah, so overall, microfluidics, using microfluidics chips seems to be most effective method for sperm selection.